So back with you again. Angela's going to be doing a double draw on her venipuncture. I will be explaining as we go along. If I miss a step or miss an instruction, Mr. Craig, you'll hear his voice chime in and say something else. Not necessarily correcting me, but picking up where maybe I've forgotten something. So Angela found her vein. She's going to use a tourniquet, and we have to remember tourniquet time is 1 minute. 1 minute causes hemoconcentration, and that hemoconcentration causes analytes to form. The buildup of the analytes can cause an erroneous result. So this is why we have tourniquet time at 1 minute, because at 20 seconds they're already starting to pull in there. Mm-hmm. She's palpating for the vein to make sure she gets a good juicy vein like a vampire. The angle.
With the 1 minute thing, the 1 minute is up until you actually put the needle into the arm. After the needle's in the arm, you're already relieving the hemoconcentration that we have created. So you pop it at halfway through your last tube.
So if you're doing 1 tube, it's halfway through that one. If it's 2 tubes, it's halfway through that one. If it's 6 tubes, it's halfway through the 6th tube. And for this procedure, you definitely have to wear gloves because it is a bloodborne pathogen per OSHA.
Has it been long enough?
Yes.
Okay.
So Angela is going to be doing it at a 25 to 45 degree angle, depending on the type of vein it is. Okay, we just cover the lumen in case we have to make minor directional changes. Perfect, Angela. She's making sure she has enough thumb pressure so the needle is not moving. And what thumb pressure she's using is the top thumb. She's pushing down on the vacutainer holder so the needle won't move as she's taking the needles in and out and releasing the tourniquet. Tourniquet released at the middle way of the 2nd tube. She then asks her patient to apply pressure while she is safetying her needle. The needle goes directly into the sharps container, and there you go.
Another thing that I want to add in here is, as you noticed, her dominant hand is the right hand, so that means all of her stuff is on the left side, making sure she's not crossing over. If you're crossing over, you're causing pain for your patient. As you see, Miss Felix is kind of showing you how that works. All right, when you cross over or cross under, you cause pain. You're moving that needle around. Okay. Now, as she puts the Coban on, she's going to explain to her patient to keep that on for 15 minutes, no longer than an hour. She's going to put a little area for the patient to get it, especially if they're an older patient, because after about a couple of minutes, it'll start to blend all together in, and it can actually act as a tourniquet, cut off their blood as well to the area. So it's very important that we make sure that she understands that part. The next part is she's going to document her tubes. Now, some offices will have labels. Other offices may be old school, and you have to put on their last name, first name, date of birth, the time, the date, where you got it from. And one of the really cool things that I did learn back when Miss Felix had her aunt come in is to make sure that you verify before you let your patient go that the name on the tube is their name for sure, and the date of birth is correct on there as well. All right. Now, one thing I'm going to get on her about is she's not wearing her gloves while touching tubes.